I work as the executive director of YPR, Young People in Recovery, and I'm also the recovery advocate / consumer liaison for the Division of Mental Health and Addiction Services in New Jersey. Across the United States, we have this problem that I've been seeing where we treat addiction as in only the acute phase, where we have a lot of treatment that's only 30, 60, 90 days of treatment, and then, you know, at the end of the day, we say, go to a self-help meeting, go to a mutual aid meeting, and there really should be more to that. There really should be more that helps somebody living with a chronic illness. Chronic meaning that this is something that I'm going to deal with and the millions of other Americans in recovery across the United States are going to be dealing with for the rest of their lives. So why are we only putting emphasis on the acute level of care? And the fact that we're actually moving towards a public health system or approach to addiction is truly amazing, because now we get to, it's at the very top level beginning to erase the stigma that individuals like me can reach their maximum potential in life, that we can change the way that we view addiction, and we can really see it as a chronic illness, that it's no longer defined simply by the behaviors that people exude because of their illness, that we no longer necessarily always approach it to by criminalizing addiction. You know, people should probably do their time and pay their fine, but there's a way to rehabilitate individuals, and there's a way to support them once they get into recovery and they re-enter into society. Now, I may be your coworker, I may be your boss, I may be your subordinate, like I may be, your judge, I may be, anybody. I could be I could be the maid, at the hotel. Like, you could be anybody in long-term recovery. And if we begin to stand up and say that that's who we are, then that would do wonders.